Alright folks, so we're going to go through the items that you received in your rectal seizure kit and talk about how to use each of these items so that you can feel confident using them at home. You're going to have a vial of diazepam. You will have a vial adapter that will allow you to draw up the medication into a syringe without using a needle. You'll have multiple syringes, and you will have a catheter that you will use to administer this drug. So for the sake of today's video, I'm going to use a vial of sterile water, and I'm going to show you how you would go through this. So first you're going to have your vial of your drug. You'll need to pop the cap off. We don't have a cap on this one, so I won't be showing that in the video. And then you will snap down the vial adapter onto the top of your vial. And then you'll open your syringe, and you'll draw about as much air as the dose labeled on your label on your package for your animal's dose, so that when you drop the medication you don't create a vacuum in the vial that would cause it to draw the dose back into the vial. You'll then connect the syringe to the adapter and twist it into place. You will then depress the air, invert your syringe, and draw up the amount of drug that's labeled in your dose. You'll then remove the syringe, and you'll open up your catheter. This package will come with the catheter that we'll be using, and it will have another piece in there that you don't need to worry about. We'll then connect this catheter to the end of our syringe, and you'll be ready to administer the drug. Alright, so now that we have drawn up our medication, we're going to talk about how we would administer this. With a dog seizing, they're going to be unconscious and their movements are going to be uncontrollable. So in that case, you're going to have to make sure that you control their tail. It may be pinned down, it may be twitching, and you're going to want to stabilize your arm a bit on the back of them because they could be shaking and whatnot. You're going to take the syringe with the catheter, and you're going to get closer up to the tip of the catheter. So when you're inserting it, you want to make sure to insert it into their rectum. It doesn't have to go very far, but you want to make sure it's definitely in. And then you will depress the syringe. There could be some leftover drug in the catheter when you've done this. That's not anything to be concerned about. And then you can clean this catheter and reuse it later on if you need to administer other doses.